Hi, I am Dr. Abhinav, pediatrician consultant in KK Swara Super Speciality Hospital. So today we will discuss about the common problem when a newborn baby is born. So the mother will have a lot of questions when they are going home. So we would like to discuss today about these general issues which will be helpful for the mother in day-to-day for taking care of the baby. The first important thing for a newborn baby is the feeding, so which is exclusive breastfeeding is advisable as per the Indian Academy of Pediatrics for the first 6 months of the life. During the feeding, it should be taken care that baby should be given feeding for 8 to 12 times per day. So baby will be taking every 2 hourly to 3 hourly. So it is better to give the demand-based feeding. So whenever you are feeding the baby, you should see the cues, baby feeding cues, baby moving their head to one side or rotating the head, or they are initial phase of crying. During that phase, it is better to give the feeding. That will help the baby to take it properly. There will not be excessive crying issues with the baby. And next thing is along with the breastfeeding. So we should not give other than breastfeeding any water or gripe water or honey during the 6 months of life. First 6 months. Honey in particular, when it is given even in drops, can lead to issues like there can be serious conditions like infant botulism which can occur. So this condition, because the digestive system of newborn is not very much formed, so it can cause to some of the toxins entering the body and causing these symptoms, and it is one of the dangerous issues. And other thing with honey, the newborn immunity is not properly developed. The newborn can develop infections, bacterial or viral infections, because honey can have some impurity. So these are the issues we have to avoid. And along with feeding, one more important thing is vitamin D. So in the first 1 year of life, as per the current practice and guidelines by pediatricians, so it's advisable to give vitamin D. 400 international units should be given daily. So this will come in the formulation as drops. While giving drops, you have to take care that these drops will be given within like 15-20 minutes after feeding. So because this is a fat soluble vitamin, so when you give immediately after feeding, the absorption will be better. The dropper which is coming, so you have to clean the dropper every time before the feeding and after feeding. So take care of the hygiene part of the dropper as well. These will be the important thing as per feeding. Then second thing is the bathing. The usual question which we face is when we have to give the first bath to the baby. So it is advisable to give bath after the umbilical cord sheds off. So this will be usually by 5 to 10 days of life. So around first week it will be falling off. After that we can give the bathing. So how much time we have to give? Usually advisable to give 3 to 5 minutes. So not more than 5 minutes, because they can't regulate the temperature, babies, and if you expose more time to the environment, so they can get cold and it can cause issues. So it's better to give complete as early as possible. And after bathing also, you have to see that you have to gently dab the baby to remove the water, but you should not give excessive force or rubbing. One more thing is, while bathing, you try to keep the head up, little bit elevated, and avoid water going into the ears and the nose. One more thing is what soap we have to give, or what we can use for bathing. It is useful to give Syndet soaps, and also any pH balanced body wash you can use while giving the bath. It is advisable to give mother and baby should be in the same room, but when you sleeping time, you can keep the baby aside from the mother. So this will avoid the serious issues like sometimes there can be smothering or mother sleep over the baby. So those issues we have seen. Some of the times the baby have lost is there due to this issue. So it is better to give rooming in, practice rooming in, keep the baby aside in a separate cabinet. So that is advisable. But in the cabinet, you keep the baby on a flat surface and avoid keeping the pillows, or avoid also keeping the toys which are fluffy toys which are there. You have to remove all everything and keep the baby on a flat surface. That is important. And one more common question we face is the baby's head. Because of keeping on this one side of the face, there can be flattening of the head. So this is another issue. But it is usually the first 2-3 months the molding of the head will happen. So we should not worry much about the flattening or of the head or other things. So it will settle down over the time. So that is not a big issue which we should be taken care. Next thing, what is the ideal temperature which we have to maintain? It is better to keep the baby in a room temperature. You can use the AC also, air conditioner, but keep it at temperature 24 to 28 degrees centigrade. So it can be given. Single layer of cloth can be given along with the head cap, glove and socks. That is advised. And one more thing is vaccination. The first vaccine includes a BCG, which will be addressing the tuberculosis, common issue. Second thing is polio vaccine. So this will be given as drops. And the third one is the hepatitis B. So hepatitis B vaccine is for condition which is affecting the liver, hepatitis infection, and this vaccine should be given between 24 hours, first 24 hours of life. But for a preterm baby or a baby born less than 2 kgs of the weight, so this vaccine can be given up to 1 month of age, and a baby reaches 2 kgs, or after 1 month of age you can use the vaccine. So it is not, it should be given immediately in this condition, but all 3 vaccines are immediate vaccine which are given at birth. For any other more information or anything, you can meet us anytime in the KK Swara Super Speciality Hospital 24/7. We are ready to provide service. Thank you.